Dr. Mukund, you have been practicing preventive cardiology as well. So we'd like to know what are the important steps to take to prevent heart attack in the future?
Well, you look at the risk factors. There are so many risk factors that all know. The most common and the very risky ones are like smoking, diabetes mellitus, family history, and high blood pressure, raised cholesterol. People with normal cholesterol also can get heart attacks. And stress and personality traits are some of the risk factors which can end up with blocks in the arteries. Some of the risk factors are reversible. But there are risk factors which cannot be changed, like your inheritance and
of course, age.
Age is another which cannot be reversed. So the others are reversible, and to a variable extent you can reduce the risk by reducing the level of risk factors.
This calcium score test, when do you undergo this test, doctor?
Simple, men above 35 years and women above 45 years. And all those with diabetes, smoking and high blood pressure are the ones to be screened for the presence of atherosclerosis picked up by this multi-detector CT.
So as a cardiologist, do you recommend that everybody undergo this test?
Well, it is the ones who have risk factors, where you assess the risk of getting a heart attack by imaging. The image gives you the picture of the coronary arteries and its status of health. Calcium score is the extent to which one is riddled or with the deposits. Extent of deposits are picked up by these tests, and based on the level of score, you categorize them in different levels and then plan the preventive strategy. It is one of the most effective tests that has come about in the field of cardiology, preventive cardiology. It has been in vogue for the last 15 years. Earlier, there were CT angiography conducted by the same mechanism, but after injecting the dye. Today, we can restrict it to only imaging without using the dye. The same system is used, and you get perfect pictures of the arteries. Based on the picture, you assess the risk and assess the scoring and plan the preventive management.
Does it give you the percentage of block like how a CT angiography gives you?
It is quite simple. It is a percentage of block is not the only assessment that is required in managing a patient with coronary artery disease. The risk of getting a heart attack is more important. So you categorize the risk based on the score and then decide whether this patient is at risk of getting a heart attack in the future based on the score level. If he has a risk of heart attack, then you take him up for the next level, that is angiography and angioplasty. If the risk is low, then you continue him on medical management. So it helps in preventing, sophisticated, avoiding many, extensive tests and simplifies the management.
So what would qualify as a bad score?
Below 10 is almost normal. Above 300 it requires escalating it to angiography. Between this streams. You have medical management as an option, and escalate it to invasive procedures like angiography only if they have symptoms.
So if the score is less minimal, that means what is the risk of getting heart attack?
Score is below 10, it is equal to or as low as somebody's risk on the road. So that's the level to which you can, differentiate between those with risk and without that risk. So if you can reduce the risk to level as low as that is comparable to a road accident, that's it. That's what we can. There is nothing like 100% in any field, more so in medicine.
So if you have identified a patient with a high score, if he does take the medications and do the lifestyle modification, can he come down to a lower score?
The score, it's a slow process of reversal of atherosclerosis. It can happen. But what we are targeting is preventing further increase in the block. That is possible with medications. And also preventing the formation of blood clots, which end up with heart attacks. That is also quite effectively done with preventive and what's called as antiplatelet medications.